I hope you can hear me. Good morning, afternoon, or evening. Thank you all for joining our webinar today. My name is Ika Novianti, and I will be moderating today's webinar. And we are excited to bring you to webinar 2 of our series convened by the Adolescent and Young Key Population Partnership. The partnership brings together youth network and UN agency to drive forward progress for adolescent and young key population in the HIV response. Today we will have 4 speakers, and as we know, for youth-led movement to be successful, we need to foster a sense of connectedness and community between the leaders and peers. This is an important but sometimes overlooked aspect of youth-led response, which we want to highlight today. Our speaker will highlight some of their programming and experience on the topic of connectedness and community, and hopefully we will able to inspire you to integrate those into your own work. There is a Q&A function, and we encourage you to ask questions so our panelists can engage with you directly. If you have any resource you would like to share with us on this topic, such as the case study or reports or paper, please feel free to share link in the chat. Without further ado, I'd like to introduce our first panelist, David. I will go with you. So, what can you tell us about connectedness and its importance to youth movement? Can you explore the connectedness needs specific to adolescent, young, and key population?
Yeah. So good morning, good afternoon, good evening, everyone. Thank you so much for inviting me. My name is David Imbago. I'm the director of the Yield Hub. I'm from Ecuador, based in Ecuador as well. I have been involved in the field of youth participation and SRHR for about 10 years now. And I'm very happy to talk about this topic of connectedness. When I was looking for definitions of connectedness, because it is a word that I don't usually use, I was looking for different definitions, and I think that the one that I like was the sense of belonging, mutual support, and collaboration within a community. And these words really resonated with me. And I think that coming from the youth participation field, from the SRHR activism, safe abortion activism, HIV and LGBTQI topics, I think that these words really felt like it is really linked with the field. So I was very happy to see those topics. But I think that beyond the words that I mentioned before, one word that probably feels more accurate for me is the word partnership as well. And for example, at the Yield Hub, we define partnership as a mutual beneficial relationship between all the stakeholders. It is a respectful partnership. It is a consensual partnership, of course. But it's also it's pretty much focused on what is the win-win situation for all the parties involved. So I think that that's to start this intervention. I wanted to mention what is connectedness for me and how I see this linked to what I'm currently doing. I think that another thing that now focusing on the youth movements, another thing that we can talk about is unity. And I think that connectedness is definitely the backbone of youth, of successful youth movements, because it allows individuals to unite around one common goal and amplify this collective voice for action. In this case, this can be, for example, the HIV response, it can be LGBTQI rights, sexual health, reproductive rights, and so on. So I think that this unity this connectedness and unity first brings people together for a common goal. And I think that that's the first step for us to move forward for something concrete. Then I think that the second step is probably support and empowerment. I think that is important to highlight how connectedness can foster an environment of support, enabling young people, young activists to empower each other, share experiences, and navigate challenges together. So the first thing is uniting people for a common goal. And then I think that is creating a supporting environment for people to be able to thrive in this new setting that we have developed. which in this case is united for a common goal, whatever it is. We know that there's a lot of activism around several issues around the youth movement, for example, beyond SRHR, which is the topic of today's session. There's also, for example, climate change. There is also a lot of work that young people have done around democracy, around peace, and so on. Then I think that the next step in this sort of ladder that I have created in my mind that I'm sharing with you today is probably the collaboration for impact. And I think that the next step in this case is also illustrating how youth movements can also lead to impactful advocacy, resource sharing, and positive change. So this means that we can also see concrete outcomes of this of connectedness when it comes to advocacy goals, for example, when it comes to policy changes in policy that we want to see, more awareness of certain topics, for example, changes in language, changes in perspectives, norm changing, which I think that in the end is what we all want to see. Now, I think that the next step in this presentation that I'm giving today is to talk about connectedness needs for adolescent and youth key populations. And I think that connectedness can allow us to understand key challenges and unique challenges that some populations face. And of course, when we talk about adolescents and young people and key populations, there's a lot of things that are not nice to share, unfortunately. For example, there's a lot of stigma, there's a lot of discrimination, there's a lot of limited resources, and so on. So I think that connectedness can lead to building safe spaces for these specific challenges that I just mentioned. For example, creating a safe and inclusive space for youth movements to address specific needs and specific nuances that key populations face, allowing them to express themselves without fear of judgment. So yeah, connectedness, like I said before, I think that uniting for a common goal, that was the first step. But I think that when we are talking about key populations, it's also important to create this safe space we have united, fantastic, for a common goal, but it has to be something more specific, something more nuanced, a space that is safer in the end. Then the next thing is definitely mental health and well-being. We know that I think that connectedness in these specific aspects of youth movements should actually not could, but should also create a safe space where people feel like they can share, navigate complex issues that can affect their health and their identities. Mental health is super important when we talk about youth movements because it takes a toll on you. It takes a toll on you to talk about these complicated issues, to face harassment, face discrimination. Advocacy and youth movements in the end can be even unsafe in some cases. So I think that connectedness and mental health is definitely linked. And finally, I think that knowledge sharing is also a key aspect of connectedness that I think that facilitates exchanges of knowledge and experiences among adolescents and youth key populations, because it fosters a sense of shared understanding and resilience, because you're talking to peers who probably understand the issues that you're facing in a better way. I mean, of course, there's academic resources and there's a lot of great literature and fantastic toolkits that a lot of INGOs have created, UN agencies have created. But to have this sense of support from your peers, I think that it is a fantastic, and it's not better or worse, but it's just different. It's something that is needed in the end. Just to wrap up my intervention on how connectedness supports youth movements, I think that I always like to make a call for action, and I think that it is to encourage the participants of today's session to support initiatives that promote connectedness within the youth movement, specifically, of course, for key populations and adolescents and youth. I think that we are all people in this webinar probably have some experience in youth movements. Of course, I came from a grassroots organization, association of students, and so on. And I think that looking back, I can definitely think of ways of how I could have done better. I think that now that we are in different positions, whether you are on INGOs, whether you are with grassroots organizations, foundations, I think that just think about these things. How can you how can you make these spaces more inclusive? How can we support more advocacy, effective and more safer environments, How can we explore intersectionality, privilege, decolonization, and so on. So we can make these spaces better for the new young people who are involved in these initiatives. Yeah, so that's it. That's it from my side. Ika, thank you so much for the opportunity to intervene.
No, thank you so much, David, for your really inspiring point around the connectedness and how the connectedness is important for us as a youth-led organization and also to youth-led movement. So I would like to move to Ali. So Ali, how does the theme of connected um, fit into your work with adolescent and young people from key population? Floor is yours.
Thank you, Ika. I just wanted to first introduce about how we are working with high voices. High voices, we define ourselves as a minorities youth-led initiative or group working for young PLHIVs and young and adolescent key population members using different digital and innovative methods to reach more and more people that are sometimes far to reach here in Pakistan. In our work, even you can see in some of the slide, I would just share like in within our group when we started working and later on we have different core groups. For instance, we have a core group with the name of Women Voices led by our very young female member Adiba Min and the other young positive people of Pakistan with our fellow Amir that's working for one side at the adolescent young girls and women and the other side for the young people living with HIV. In our work, to the next slide, I will just try to show some of the activities we're trying to do together within this our group, ranging from diverse activities, not only just awareing young people about the HIV and related issues and prevention methods, but also some of the issues that we face in the country that are linked to these in terms of security and in terms of security and the other, for instance, in terms of the climate and how we are actually affected by those issues together. These are some of the activities mentioned particularly here. We have been engaged ensuring that the adolescents and young key population voices are heard, which includes not only mobilization of our members and capacity building trainings for them around the processes and the methods and platforms available on the ground, but also making our voices heard at the national and global stakeholders level by doing letter campaigns or story campaigns using these digital and social media and with the other global partners. So this is some of the activities in terms of the picture, and also I would like to mention around the work we are doing for adolescents and young girls' reproductive health and rights. Um, uh, to the question around how our work is connected to the theme around connectedness, I think the theme of connectedness is at the heart of our working, especially as I mentioned in this conservative country where not only key populations are criminalized, but also sometimes having a safe space to work around for us. We sometimes feel a pressure from different factors, either can be from security related things and other stakeholders, and so to that kind of it prevents us to be more and more into the system and activities. Through understanding the conditions, I think how we deal them, we on the grounds as a young people and as a peers, sometimes as a peer mentors for others, we know how to deal those issues that we face on the grounds, and we are continuing to do our work, ensuring that the young people from KP and other stakeholders are connected, and we are making our voices heard. And that is, I think, is the way we can create more inclusive and effective response for HIV to continue our work. In terms of our folk, in terms of the things that I think we can do more as we move forward, is that we when we are working for vulnerable key populations, we sometimes overlooked some of the issues that are interconnected or linked. And that is also we try to highlight and work around in our work. For instance, when we have different key populations or young members from different key populations, and they sometimes they don't understand how for instance, an issue from one key population is somehow linked to the issues of another. So we have done these exercises in our programs and activities where we have not only aware them, but also make these groups so they can work together on these particular issues for the particular cause. Um, an example of this, I like to hear a message I received from one of our member in Young Positive People of Pakistan around how he has been benefiting from the work we are doing, and that's kind of somehow links. I would just like to play their message if possible, and then end my answer with their reply. Yeah. Oh my goodness.
Assalamu alaikum and hello everyone. My name is Awais Aslam and I am a young man living with HIV. When I was diagnosed through a community-based organization working for key populations, I felt the need for additional support and a desire to contribute to my PLHIV community. I connected with the Young Positive People of Pakistan, a youth group of individuals living with HIV in Pakistan. 5 Plus Pakistan not only helped me feel supported, but also empowered me in navigating HIV related systems in Pakistan. Since becoming a member of the Young Positive People of Pakistan, I have expanded my knowledge about the Global Fund process in Pakistan and learned about the contributions of various stakeholders, including UNDP, UNAIDS, different government agencies, and the AIDS Control Program in providing health services. This involvement has enabled me to address our issues in community and civil society statements, consultations, and take advantage of opportunities to represent young PLHIVs on national and international platforms. This not only benefited me, but also positively impacted other individuals connected with us. I now feel empowered to advocate for our issues and raise our voices. Recently, we condemned the killing of a young PLHIV while in police custody, highlighting the ongoing challenges to save the lives of PLHIVs from stigma, discrimination, and violence. Despite these challenges, we remain committed to our efforts. As a young person from Pakistan, I believe that platforms like the Partnership for Adolescents and Young Key Population are effective ways to collaborate for our cause. Thank you so much.
Yeah, so just the way we are connecting and doing work on the ground, I think is for us, for the global organizations, and for the partnership is that we should continue this work on the global level as well. Thank you. Over to you, Ika.
Oops, sorry. Thanks, Ali. I totally agree with you too on the importance empowering Yankee population to come together and support on each other issue. Also ensuring that they have safe space to work and raise their voice. So thank you so much for bringing that up. So I'd like to go with Aaron. So Aaron, how does connectedness fit into youth-led movement for adolescent and young key population rights that you have supported? And how critical is it for this to be present for strong and sustainable movement? Over to you, Aaron.
Thank you. Thanks. Hi, everyone. I'm actually very thrilled to be invited to provide insights to this quite under-discussed topic. So I'll just introduce myself to start with. So I'm a research and policy officer at the Human Rights Directorate in Malta, with my focus primarily being LGBTQIA plus policy, which is of course very much intertwined with HIV prevention, and also with a personal interest in sex workers' rights, body autonomy, and representation in general. So to have such a conversation, we must reflect on the shared experiences that bind us. We all navigate a complex crossroads of identities, rights, and challenges. In this complexity, while every individual remains unique, connectedness emerges as the line that holds together diverse forces and perspective. Think about the communities you're part of, right? So how has a sense of belonging influenced your engagement, your willingness to share, and your collective pursuit of common goals? That feeling of being seen, heard, and supported is the essence of connectedness, really. So every time we see ourselves on the media, right? Every time we see ourselves reflected on in politics, on the political arena, we feel like we're actually being there. We're like involved in the decision-making process. So if we just had to focus on the virtual spaces we inhabit, social media, online forums, digital campaigns, they all serve as bridges connecting us across borders. They are platforms where we share stories, mobilize support, and collectively amplify our voices. These tools empower us to be part of a global dialogue on crucial issues, breaking down barriers and fostering a sense of unity. In the digital age, everyone can be an activist. Social media has emerged as a force to be reckoned with, and even so in Malta, it has been pushing for political decisions to be changed and also to shift the focus on what really matters. It is a tool that is up to us to be determined on whether to be used for good or not. Another cornerstone in connectedness is mentorship. It's the idea of guiding and supporting one another on the shared journey. And whether you're a mentor or you're a mentee, the power of passing on knowledge goes beyond individual experiences. It's about creating a chain of support that stretches across time and generations. We have actually seen this emerging within the local LGBTIQ plus movement. So the LGBTIQ plus movement here in Malta, where after years of various activists taking on the fight for equality, around 20 years since actually the first LGBTIQ plus rights NGO was set up in Malta until the first few LGBTIQ plus equality decisions were taken, we have seen how these different activists have found the right political climate then to actually achieve what has been achieved, and Malta cementing itself as a beacon of hope in the European Union and across the world when it comes to LGBTIQ plus rights. But it is also knowing when the baton is to be passed to younger activists and for them now to take over the fight, especially when it comes to HIV prevention, which remains quite an area that in Malta is pretty much still stigmatized, untalked about, and more often than not remains within the shadows. Challenges are universal, and we all encounter obstacles in our pursuits. The strength lies in how we collectively navigate and overcome them. Think about a time when your community faced adversity. How did you come together as a community, strategize, and emerge stronger? Connectedness is the force that transforms challenges into opportunities for growth and resilience. Consider the impact of collective efforts in improving access to healthcare, a basic human right, whether in your local community, globally, on a European level, at any level, right? Advocating for inclusive practices has tangible effects. Inclusive language and cultural competence training, for instance, can significantly enhance access to vital healthcare services, especially also in the realm of HIV prevention. In fact, as a government, as the Maltese government, we've seen this and sought to include young activists in devising strategies for HIV prevention. In fact, over the last month, and expected to start very soon, the government has allocated funding and the premises to a local organization for them to directly carry out testing among the LGBTQIA plus community. This is a way to improve accessibility and encourage more people to get tested away from the stigma that still persists within our society. So in conclusion, allow me to just say that connectedness is not just a buzzword, but a lived experience that unites us all. is the common thread that in our narratives that bridge across our diverse journey. Thank you for listening, and thank you for allowing me the space to share my insights.
No, thank you so much, Aaron, for your powerful insight. Let me move to our next panelist, Shirley. So I'll go to you now. The Adolescent Wellbeing Framework contains connectedness as one of its 5 domains. How are agencies supporting taking HIV out of health sphere for adolescent and young key population and addressing the wider well-being topics? Shirley, over to you.
Thank you so much, Ika, and great to join this webinar on this very important topic, and great to see you too. So the next slide, please. This important topic of taking HIV out of health. So I'd like to share I'm joining you from Jordan in the Middle East. So this presentation focuses on some of my experiences of what we've been doing as part of the UNICEF Middle East and North Africa Regional Office on how we are addressing HIV in the context that you see. So as all of us know, the Middle East and the North Africa region is laden with political instability, armed conflict, natural disasters, migration, forced displacement, a lot of issues when it comes to our marginalized populations, including the refugee populations. So young people in this region are not only vulnerable to HIV, but they also are vulnerable to many other health threats because of the breakdown of governance, damaged public infrastructure, disruption of public health and essential services. And you can see, like in countries like Sudan, everything is broken down. There's no public health system. There's nothing that exists. And also what you're seeing in Gaza right now. So it is in this context that we're talking about HIV, and we've been giving a lot of thought about how do we address HIV within these contexts. And next slide, please. And if you look at that again, coming from, the context that we are in, like, what our colleague David and, Ali Raza and Aaron spoke, the Middle East is no different, and we are in a concentrated epidemic context. And the underlying factors driving the HIV epidemic are also undermining the health and the well-being of adolescents and young people generally. And HIV-related services and supports young people as well as young key populations are scarce. Data is very limited, as you would also experience in your own countries, and intense stigma and discrimination, punitive policies and laws, and healthcare staff, many of them, as we've discussed, a year ago, we had a meeting and we had a training for the primary healthcare staff, and they really struggled with saying, how do we work with adolescents? We really need the skills. We don't know how. When a young teenager comes to us, we have very limited capacity to provide the services, or even basic things like communicate with them and talk to them, and to be able to get down to their level to understand the issues when they come to access services. And also we know that, like, all of us can vouch for this, that that the funding for HIV in the last for some time now has been going down, and has been a real challenge for many of our responses in the way we want to respond. Next slide, please. So what is the needed response from our side? So when we talk about connectedness, I'd also like us to really place this in the situations that we are in today, to see how do we address both the direct and indirect causes of the epidemic as part of our ongoing efforts, and at the community and at the other national levels. So, and one is the ensuring integration of planning, resource and programming to enable a multi-sectoral and multi-stakeholder response, which many of us, our organizations as well as our networks, have been doing, to go beyond health and to look at education, child protection, nutrition, and social protection sectors, because it's the same young person and the adolescent who needs to navigate through these continuum of care, and requires the different services. So it is really important to not only look at the things HIV from that one point of view, but also it is the same person who has multiple needs that we need to respond to, and ensure sustainability of the response. Like in our region here, the financial resources that we 82% short of what we need to reach the 25% target. Next slide, please. So in this pursuit of like, how do we deal with HIV in this context in the region, we launched into an effort of understanding, doing this quantitative and qualitative analysis on broader adolescent health and well-being for the 10 to 24-year-olds in 20 countries, looking at the global database, national surveys, the data that we have. But accompanied by this is also to do a qualitative analysis of what are the key determinants of physical and mental health and well-being as identified and described by young people and caregivers in 4 countries: Egypt, Lebanon, Iraq, and Yemen. And the link to the first document, first quantitative analysis, I've put on the slide here, and then you can access it. And let's go to the next slide, please. So if you look at the slide, you can see that, in the bar, in the graph that you see, it's the non-communicable diseases. The blue color that you see, like the blue in the graph, is NCDs, non-communicable diseases, which is around 36%, and communicable diseases is about 6%. But yet, it's important for us to address HIV within those communicable diseases. And then you have mental disorders, issues, and then injuries, which is a top on the list. So we've been thinking of saying, how do we advocate for HIV in this region, and what are better entry points? Next slide, please. And also you will see that in this slide, there's like the estimated deaths of 10 to 24-year-olds. Again, you can see that it's the transport injuries, unintentional injuries, given our context of conflict and, the situation that we have, as well as you look at non-communicable diseases. And the communicable diseases is, if you see, is still the mortality. We do have it, but again, it's not as much as not as big as the other areas. And next slide, please. So what are better entry points to address HIV? And let's go to those. Let us look at some of those key considerations for how do we address HIV within these contexts. So one of the areas is definitely to understand the epidemic better, and also not just that, but also to understand what's happening to young people in the other areas, looking at quantitative as well as qualitative research. And I cannot underemphasize the importance to empower communities and strengthening community systems. As part of all of this work, we also did an assessment on young key populations in the Middle East and North Africa region. And one of the things that kept coming back to us was it was not the governments that were, or the health facilities or the primary healthcare systems that were able to catch the people, who are vulnerable, who are at higher risk of HIV. But however, when we spoke to the communities, it was there as part of their efforts that they were able to, to meet the young people who are at risk, and were able to provide HIV testing and other services. However, in the healthcare system, given the stigma and the discrimination that many of our other speakers pointed out, they were not able to identify as many young people who needed testing and treatment and care. So it is really important here when I say that, when we talk about community strengthening community systems. So as part of the work at UNICEF, we currently also undertaking a community level assessment to understand what's the policy environment, what is the support system in place, what are communities doing, and what are those community service delivery packages that are available that are in the formal system. Because many times the informal system, because of financing, because it's not integrated into the formal system, is not sustainable. So the question for us is, how are these part of the formal system where we can talk about the sustainability over a long time, because these are not one-off services that happen today and tomorrow. When funding is not there, we don't have money to continue the services. But how can we integrate what we are doing into the formal system, and what components of HIV could be integrated into the existing packages? And next slide, please. And as part of this work also, and our colleague David mentioned about mental health and well-being. So this is also a great entry point given where we are in our regions, especially looking at within the responsive care for those with mental health conditions, prevention of poor mental health by addressing risk and protective factors, as well as mental health promotion. So we did this study in 6 countries on integration of mental health and psychosocial support in primary healthcare, and also to understand the linkages with other sectors like the education, the child protection, the social welfare. So we came up with very interesting findings, and these 3 reports will soon go up on the web, so you can also have, and to specifically identify who can do what within the primary healthcare and the community system, and what are the specific things that need to be strengthened. Next slide, please. And I cannot again emphasize the importance of improving the protection of young people, especially from violence, child marriage, the FGM in this region, including through policy, legislation, and programs, and addressing harmful social and gender norms, and also the meaningful engagement of young people, the participation in education, training, meaningful work, as well as greater participation in decision making and public engagement on the issues. I mean, also finding entry points for HIV within the other areas that are currently on the agenda, on the radar of the governments and the countries, and how can we find different entry points, like also in there looking at climate crisis, environmental sustainability, and in all of this find appropriate entry points for us for HIV. And this, I don't have the answers to all of this at this time, but I just wanted to say that these are some of the areas that we can continually brainstorm, talk about, and we need to be dialoguing a lot within ourselves to see what are those better entry points for HIV. Thank you. Back to you, Ika.
Thank you so much, Shirley. So once again, thank you so much to our panelists. I totally agree with what has been said on connectedness. As David has mentioned, connectedness is a sense of belonging, uniting people to get mutual support for community, and also to get a positive change. While Ali has mentioned the importance to bring young people together to support on each other issue, Aaron also mentioning about the how connectedness can change challenge into opportunity, and how we can use the digital platform to do the advocacy work. In addition, Shirley has also mentioned the really important notes that HIV is not only problem for the adolescent and young population, and also how we need to improving the protection for young people with a focus on protection from violence, child marriage, including the policy, and ensuring meaningful participation of young people in the program. So if you have any question, we would like to open the Q&A function. If not, then I will ask one more question. So we got one question from Sandeep Sahi. What would be the key consideration for HIV response in rural areas? So anyone wants to respond to this question? Ali, over to you.
Yeah, so I just raised hand because it was so close to some of the work we have observed and the challenges. Because here we found that the lack of services sometimes. Earlier, there was lack of services even in the towns. For instance, my town, it only got HIV-related services or key population-related services only in 2018. Things are getting improved, for instance, in my region, but still it's very, I would say, very backward or very hard in the rural areas, and the needs that are required. And the more I observe during my work, like the adolescents and young people in the rural areas are sometimes more prone to these issues. So there is issues, but And yes, I just wanted to add, there's no more need to work for the broader community, but I think the social media platform, as I shared by Aaron or David, I think is a platform where which is making not only aware to all adolescents and young key populations across the regions, because even if you are in a rural area, you have access to this internet and you can get information, and so that's a bit from my side.
Thanks, Ali. David, do you want to add?
Yeah, no, thanks for the question. I worked for a year in the Amazon rainforest as a medical doctor a couple of years ago after I finished med school, and I think that when we think about connectedness, that really, of course, there are different challenges in the rural settings. For example, there's distance. For example, there's geographical distance. When we talk about lack of roads, lack of proper infrastructure to facilitate the connectedness that I think that is pretty much has a Western mindset, has a romanticized mindset even. So I think that when we talk about the reality that people face, I think that we can talk about connectedness in a very Pinterestic way, if that makes sense. But I think that of course there are different challenges, and of course internet access, for example, is another one. Now nuancing this into the HIV response. I think that this lack of social networks that have been developed in the rural settings make it even harder to reach young people and adolescents in some cases. And all we know that everything is connected, and this also links, for example, with pathways to adulthood, for example. How is this linked to the opportunities that young people have when they want to become adults, and so on. So yeah, now talking about the HIV component, I think that of course there are more challenges to create a youth movement in these settings, and we rely more in these cases into the adults, for example, into the adults who are in the positions of power, who are, for example, leading the healthcare facilities, leading the education facilities. So I think that, yeah, probably those are areas where we do need to strengthen with knowledge, with evidence, with this sort of mindset of allowing young people to create a youth movement and so on.
Thanks, David. Since we still have time, so I would like to ask one more question to the panelists. So how has a sense of connectedness within movement you've been a part of contributed to your health and well-being? Anyone want to respond? Aaron?
Just maybe repeat the question. Yes, I'm not sure I got it all.
So how has a sense of connectedness within movement you've been a part of contributed to your health and your well-being?
Yeah, I think it also brings you pretty much aware, right? So to be an activist and to be part of such a movement, you first of all have to make sure that you are yourself living by what you preach ultimately, right? So you are getting tested yourself, you are actually knowledgeable about the topic. So that also gives you first-hand experience and a standpoint from where to actually start from. So yeah, pretty much that gives you a lot of awareness. It also gives you a sense of community. So knowing that you have other people to rely on, knowing that you have sort of a like-minded community that strengthens one another and can support one another, especially in certain gaps that might emerge. So some of us might be better off when it comes to the medical part, others might be more empathetic. So that also gives you those particular tools when dealing with people who have been recently diagnosed with HIV, but also in the case and instance that one from the closer community that gets diagnosed, and how to prevent it, right? And knowing the right tools to prevent HIV.
Thanks, Aaron. I think we get one more question from the Q&A function from Ponciano Apa. What resources are available to support initiative about young people living with HIV? Ali, Shirley, or David, if you
Yeah,
have any
so
kind of source. Yeah.
Yeah, so there are resources available, especially for instance, this platform like the partnership of adolescents and ayKP and the networks that are associated with here. We have youth groups. The resources are limited but available. So that's I would say, and there is a need to work more and more for more and more resources. So I think it's good to stay connected with the youth networks and groups and look out for the opportunities. But in particularly, in terms of the Global Fund, what I have observed and we have tried, when the process for the funding request happens, so there are when there are groups and they consult and they give their input, so there are funding available for more and more activities if you work around and contribute into those. So that's one more.
I think it also has to do a lot with making those funds available to people. So we know that both youth organizations, but also non-youth organizations, most of these organizations function on a voluntary basis and mostly by volunteers. And of course, they don't have the time to actually invest in so much bureaucratic work, and much rather invest that time in actually engagement with the community. So I think we need to see those funds, the applications that we have, how much they are accessible to the community itself, both in the language that is used, both in the added bureaucracy that might not actually be necessary, but more there just to satisfy God knows whose needs. So ultimately, it's how much we're actually there with the community and how much we're making it easy for people to get the money, and which is ultimately invested back into the community, and it's much easier to prevent rather than to actually then treat. So yeah.
Thanks, Aaron. David, I
Yeah,
see you.
just on the topic of resources, I think that linking it with the topic of connectedness can also lead to coalition building, and coalition building can also improve chances for resources to be allocated to certain organizations in the case that yeah, there's some challenges when it comes to administrative requirements or other requirements that the foundations may have. But yes, I mean, connectedness can lead to amazing organization joining together, smaller, bigger ones, and you know, in different fields for successful applications, for resources, for communities, and so on.
Thanks, David. Shirley, over to you.
Thank you, Ika. Just to add on the resources, I think, right to healthcare is one's own right, right? To find those resources. So it's really important to understand that the access to treatment or care, this should be part of the healthcare system, right? The primary healthcare, the health system should be able to provide this. So I think a lot of times we need to really advocate for inclusion of this into the care packages, and that's why it's really important for us to know what's happening in that arena, so that we will ensure more domestic financing to go into the system, yeah, as part of the government system, so people have the right and the access to these services, and you don't have to still keep finding as part of universal health coverage. So this is really important, and I think we that's why it's important for us, while we're trying to find these funds and try to also mobilize resources, we need to also advocate for some these services to be included as part of the healthcare benefit packages for the community, so we don't have to be these are already provided by the government as part of the services to people. Yeah, thank you.
Thank you so much, Shirley. Is there any other question that we haven't answered? Let me check on the chat. No. Okay, then, if there is no more question, I would like to close today's webinar. Once again, thank you so much for our panelists, and thank you for participating in the webinar. Yeah, as the theme for today's is connectedness, so please stay connected and make a coalition for youth-led movement. Thank you. Bye.
Thank you so much, everyone. Bye bye.
Bye.